we would like to celebrate the life and accomplishments of Paulette Kloes, a beloved member of our medical informatics engineering family. Paulette was a key stakeholder in the selection of WebChart and was the lead global manager responsible for consulting, planning, and implementing a global electronic medical record system for occupational health at Dow US and global manufacturing sites worldwide. In 2012, Paulette retired from Dow and came to work at MIE as a clinical consultant for Enterprise Health. Over the years, Paulette made significant contributions to Enterprise Health with her years of nursing experience and expertise in clinical workflows on a global scale. Under her leadership, Dow Chemical became our first occupational health customer because she believed in our ability to transform our WebChart product into an occupational health solution. Paulette was instrumental in those early years of driving our product development and ensuring that Enterprise Health met all of the key requirements needed by an occupational health provider. Paulette retired for good in June 2016 to spend time traveling and enjoying retirement with her husband, Randy. Throughout her career, Paulette received many accolades and awards. The Transformation in Action Award distinguishes those employees who exemplify transformational competencies in both results and behaviors through their ongoing actions. Paulette received the Health Information Technology Innovation Award in 2010. In 2008, Paulette received the Extraordinary Leadership in Health Services IT Award, as well as a Training Excellence Award. In 1994, she received the C. Everett Koop National Health Award, which is given by the Health Project Incorporated. During her time with us, Paulette made a lasting impact on our organization, and her work will continue to be felt for years to come. Her tireless efforts to improve our occupational health product were nothing short of remarkable, and her passion for delivering the best possible care to our customers was evident in everything she did. Paulette was more than just a colleague. She was a mentor, a friend, and an inspiration to us all. Her passion for improving healthcare through technology drove our product development of Enterprise Health, and she worked diligently to ensure that our systems seamlessly communicated with each other, ultimately improving patient care. We are grateful for the time we had working with Paulette. Her memory will live on as we continue to pursue excellence in our work and strive to honor her legacy.
Enterprise Health is actually because of Paulette. And she was just such a special person to share time and her talent and her ideas with us, and also motivate us to, pursue that area of specialty.
My wife and I enjoyed traveling, and back in 2016, we were planning a trip up to northern Michigan. I sent Paulette an email just asking what things we should try to see in Traverse City, and that was all it took. She had put together a full itinerary for us, places to go eat, things to see, a lighthouse to climb up, but that wasn't it. She invited us to meet her and Randy at their home, and then they spent the day driving us around to all of these different places. It was just such fun being with them, and we were just so impressed by their kindness and hospitality. Paulette was just such a positive, friendly force to be reckoned with, and we'll never forget her.
Of course, I think my favorite story about her, my favorite memory about her was early on. I was working from home, and this was way back before it was really cool to work from home, right? But I had a couple of days that I would work from home and remote in. I was on the call with her, and my son Wyatt, he wasn't even in kindergarten yet because he was still home, so he's probably 4 or something, and he burst into the room, "Hey, Dad," blah, 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 and started talking to me, and I quickly muted and said, "Hey, buddy, let me finish up this call. I'll come back to you." And, Paulette had, I know she heard, obviously, before I muted, and she waited kind of patiently for me to talk to him. And when I came off of mute, I kind of, "Oh, sorry about that." And, I'm thinking in the back of my head, "Oh, geez, this doesn't sound very professional, right? It's kind of abnormal. You shouldn't have your kids burst in on your work phone calls." But all she said was, "Oh, little voices are the best." So yeah, that was pretty great for me.
I mean, Yeah, she is by far one of the best people I've worked with throughout my going 21 years here at MIE. She was back then our guiding angel, and I'm hoping now our guarding angel.
One of the reasons I say the 5 whys all the time is because she mentioned it. She goes, well, you got to go do the 5 whys. I'm like, what's the 5 whys? A legacy is her impact in telling me that you got to go learn, oh, you don't know about the 5 whys? Go read about it. So, and I fell in love, obviously. So
Paulette's legacy will live on in our interoperability lab. Today, we proudly dedicate this space in her honor, ensuring that her contributions to medical informatics engineering will never be forgotten.
Naming the research and development clinic after Paulette just recognizes the major impact she had in occupational medicine and pretty much in the innovation of our software. A lot of the ideas came from Paulette's initial vision of what software should do for managing medical surveillance.
Paulette, if you're listening to this, and I'm sure you are, thank you for everything. You have been an inspiration to a lot of us, to most of us, and those who knew you will never forget you. And thank you for everything. May your memory be eternal.